I want to thank you for your interest in the 2019-2020 Lucas County Community Health Assessment. My name is Emily Gensler, and I work for the Hospital Council of Northwest Ohio, and I'm the project manager. This report, released on December 8th, provides an overview of health-related data for Lucas County adults, youth, and children who participated in a county-wide health assessment survey. This survey was from November 2019 to March 2020, and are based on self-administered surveys using structured questionnaires. The purpose of this PowerPoint presentation is to explain the design and methodology of the Lucas County Health Assessment. We also have 5 additional presentations released today that are split up into the health status of each individual population surveyed. Please reference the separate PowerPoints that you might be interested in to dive a little bit deeper into the findings. You can also visit healthylucascounty.org to view the full report. The Healthy Lucas County Executive Committee commissioned this report. To give you a little background, Healthy Lucas County is a collaboration of community organizations working to improve the health of all residents in Lucas County. This report would not have been possible without the collaboration, expertise, and funding from an extensive list of partners that you will see on this slide and the following slide. To give a little bit of a background, this group came together in 2019 to develop the questionnaires, review the draft data, and then assisted in finalizing the full report. Here is a continuation of other Healthy Lucas County Executive Committee members that were a part of the community health assessment process. I would like to also acknowledge the work of the Hospital Council of Northwest Ohio. The Community Health Improvement Division was responsible for overall project management, which included secondary data analysis, data collection, and report development. For those not familiar with the Hospital Council of Northwest Ohio, or HCNO, HCNO is a regional hospital association that represents and advocates for its member hospitals. The Community Health Improvement Division has been working with Lucas County to complete their CHAWS since 1999. You will also see Dr. Dake and Dr. Deere on the bottom of this slide. Our data analysis is completed by Dr. Joseph Dake at the University of Toledo, who is a professor and chair of the School of Population Health. Dr. Aaron Deere is our outside consultant who reviews our reports before they're finalized. Here is an overview of all of the sections that you will find within the Lucas County Community Health Assessment. You will find adult data, which is also broken into African American and Latino specific sections. You will find youth data, which represents 6th through 12th graders in Lucas County, and also child data for those that are in between the ages of 0 to 11 years old. It is quite an extensive report, over 300 pages in length. If you would like to dive deeper into any of these categories after reviewing the additional presentations, I definitely encourage you to do so. The individual presentations give just a small snippet of the data that you'll find in these sections. Again, you can find the full report on Healthy Lucas County's website. Now, I'd like to share some information regarding our methodology, first looking at the design. In 2019, the Healthy Lucas County Executive Committee came together to determine the content of the surveys for the adult, youth, and child assessments. The group reviewed master questionnaires to determine what questions they would like to incorporate within the surveys. The committee really values their trend data since Lucas County has been completing health assessments since 1999. So this process is very important to ensure reliable and valid questions are being asked to Lucas County residents. Additionally, when selecting questions, the committee chose the majority of questions that come from national sources. So we can directly compare Lucas County data with both national and state level data, as well as additional counties in the state of Ohio. Under instrument development, you can see the acronyms for these national surveys, which are the Behavioral Risk Factor Surveillance System, which is adult data from the CDC, the Youth Risk Behavioral Survey, which is youth data from the CDC, and also the National Survey of Children's Health, which collects child data from the U.S. Department of Health and Human Services. Again, it's imperative that we ask national questions to compare our data to really know how Lucas County is doing health-wise. Next, I would like to share the biggest part of our methodology, which is the procedure in which we collect data. The first process that I would like to share is very similar for both the adult and child assessments, so please just keep that in mind as we move forward. For the adult and child assessments, we send a mailing to Lucas County residents. We retrieve addresses from a company called Melissa Data, in which we randomize prior to sending out the mailing campaign. Anyone with a valid governmental ID can be chosen. In past assessments, committee members, some of our hospital CEOs, and even my dad has been chosen in the random mailing. To give you an overview of the quantity within the mailing, we sent the adult mailing out to 6,800 residents. The mailing is so large because the Healthy Lucas County Executive Committee chose to oversample the African American and Latino populations to ensure that we had enough representation to have separate report sections to compare the health of minority populations in Lucas County. 2,400 surveys were sent to both of these populations. For the child mailing, we sent out 5,000 surveys to parents of 0 to 11-year-olds to complete the child survey. This quantity is so large due to the transient nature of the younger population. This mailing campaign that I'm referring to has two parts. First, we send a letter to residents to let them know they may be chosen to receive a survey in the mail. This letter explains the purpose and importance of the community health assessment. Additionally, this letter was created on Healthy Lucas County Executive Committee letterhead and signed by the Executive Committee Chair and Vice Chair of the group. Weeks following, the same group receives a packet in the mail, which includes a letter explaining that the resident was chosen to take part in the survey. The actual survey that was created by Healthy Lucas County's Executive Committee is included, as well as a $2 bill as an incentive to complete the survey. Additionally, the packet includes a postage paid envelope to send the survey back to HCNO to analyze the data. The letter and survey explain that the survey is anonymous and there's no way to know who sent back the survey to us because they are not coded or tracked in any way. On the next slide, we'll explain how many surveys we received back and talk a little more about analyzing the data. Before we move on, I did want to discuss the youth portion of our methodology because it is a little bit different than the adult and child assessments. To give an overview of this procedure, the survey was approved by participating superintendents in Lucas County public school districts. Once we receive permission from the superintendent, we work with their individual schools to coordinate the administration of the youth survey. Schools and grades are randomly selected. Of course, the larger districts have much more of a chance of having more grades and schools chosen. Again, as mentioned in previous slides, this survey encompasses 6th through 12th graders. Before the survey is administered in the schools, principals choose random classrooms that students have an equal chance of being in, and passive permission slips are sent out by the schools. The schools complete this as they have all of the student information to send out the passive permission slips by mail. HCNO provides them with postage, letters, and envelopes, and the school sends these out to parents of the selected students. When I say passive permission slips, this means that the parent has to send the permission slip back to the school if they do not want their child to take part in the health survey. The schools then keep track of this information to ensure that those students are not surveyed. The actual survey is administered on SurveyMonkey for the youth portion of the health assessment, as the students are pretty used to these online platforms, and this is much quicker to collect all of the data. This next slide is showing each population that was surveyed and the number of surveys that came back from each population. As mentioned, for the adult portion, which includes the general sample and the African American and Latino oversample, we sent out 6,800 surveys. We received a total of 698 back. We run a power analysis, which tells us how many surveys we need to receive back for the results to be representative of Lucas County adults. Our power analysis number was 384 surveys, and we received back 698 surveys. When you see the N with the equal sign, that's showing the total sample received. For the African American and Latino populations, 146 came back from the African American and 114 from the Latino population. Please keep in mind that all of the responses that came back from all populations were before the COVID-19 pandemic. Specifically, the last of the surveys came in for analysis in mid-March. The CI with the plus or minus sign is showing us our confidence interval. Our margin of error for the general adult population was 3.71 for the adult assessment, and this means that the statistics within the report will be within 3.71 percentage points of the real population value 95% of the time. Most researchers shoot for a 95% confidence interval, which would give us a 5% margin of error, so anything less than that 5% margin of error is great. For the youth response, we received over 1,000 surveys and surveyed in 28 total schools in Lucas County. You will see our margin of error at 3.01. Lastly, for our child mailing, we sent out 5,000 surveys of parents of those 0 to 11 years old and received a little over 300 back, and our margin of error for this population was 5.61. This is the last slide for our methodology portion of the presentation, first touching on data analysis. Dr. Dake from the University of Toledo uses SPSS 26.0, which is a statistical software program to analyze our data. Specifically, he's able to weight the data for the adult and youth populations to accurately reflect Lucas County's population statistics. Just as an example, if the data came back 60% female and 40% male, and Lucas County's census information tells us it's supposed to be 50-50, this is taken into account, so it's as accurate as possible to what Lucas County's demographics represent. The adult data is also weighted by age, income, and race. Of course, there's always limitations to research. First, our data collection is self-administered via written surveys. The CDC collection differs in the sense that they still use telephones to call and survey people over the phone. Also, the data is self-reported for the CDC as well. This data is not coming from actual medical records, but people reporting their health status themselves. Lastly, caution should be used when the data is broken down into further categories throughout the report. Every time you do that, it's a smaller sample size and the margin of error increases than the full population statistics. Before we move on, we also have an institutional review board out of Maryland who reviews all of our surveys, the letters that go out to the community, and our methodology to ensure that we are doing good research. Now that we are finished reviewing the methodology portion of the assessment, I wanted to touch on our comparisons. The Community Health Improvement Division from the Hospital Council completes health assessments or health improvement plans in all of the counties that you are looking at in red on your screen. Not only do we work in Ohio, but we also work in the state of Michigan and Oregon, and now most recently in the state of California. We also have a feature on HCNO's website called Data Link, in which you can compare Lucas County's data to other county data. For example, if you want to look at youth smoking percentages and compare to neighboring communities like Wood County or Fulton County, you can click the indicators and counties that you would like to view and see all of the data on your screen without reviewing the entire reports for each community. The next 4 slides are looking at our adult sample demographics. If you would like to see more breakdowns, you can view the appendix of the full report. First, we are looking at income for the adult population. We did a really good job of reaching lower incomes within the written survey. 25% had household incomes of $25,000 or less. This was also pretty close to census estimates, so we do not have to weight this data as much when it comes to analyzing the data to reflect Lucas County census demographics. The next demographic category that we're looking at is education. Education was broken up by less than high school diploma, and then some college or college graduate. As you can see, 66% of Lucas County residents reported some college or college degree. Also, 7% had less than a high school diploma. The next demographic that we are reviewing is race and ethnicity, which actually very closely mirrors the last Lucas County assessment in 2017 with a similar breakdown of race and ethnicity. The largest group that you will see in the pie chart is white at 55% of responses, followed by African American at 21% and Latino at 16% of responses. Again, both of these populations, African American and Latino, were oversampled for the health assessment. The last category that we are reviewing is marital status, with about half of the responses reporting being married at 47%, 22% reported being never married or a part of an unmarried couple. Also, we have categories such as those that are widowed or divorced or separated. That concludes our methodology presentation for the 2019-2020 Lucas County Community Health Assessment. Please check out the additional presentations to get a brief overview on the health of Lucas County residents, or review the full report on Healthy Lucas County's website. Thank you so much for your time, and please feel free to reach out via email with any questions. Here you'll see the link to our participant feedback survey, which is on the SurveyMonkey platform. We ask questions that will help the executive committee move forward with planning for their next community health improvement plan, which is the next step in this process. Thank you so much for your time.